Hi, my name is Brianna Herron, and I'm a senior oncology pharmacist here at NCCN. And today I'm going to talk about the library of NCCN Compendia, along with my colleague, Marian Birkeland, who is the senior director of Compendia development. So the NCCN library of Compendia are based directly on the NCCN guidelines, and we have 4 compendia. So first is the Drugs and Biologics Compendium, and that's the product that I work on. We also have the Biomarkers Compendium, the Imaging Appropriate Use Criteria, or NCCN Imaging AUC, and the Radiation Therapy Compendium. And today we'll go over all of these products. And this slide shows an overview of our compendia process. So as I mentioned, the information is extracted directly from the guidelines, and that will include the algorithm pages, the applicable principles pages, and the footnotes. And as the guideline is being updated, the compendium will be updated and first goes through an internal review process. After that, it goes to panel member review. So one of our physicians on the NCCN panel from our member institutions will review the compendia products. And last but not least, the updated compendium is posted in conjunction with the guideline update. So speaking for my own compendium, the Drugs and Biologics, we post that within 5 business days of the guideline being posted. And now I'll talk about the Drugs and Biologics programs. So that would be our Drugs and Biologics Compendium. We have a team of pharmacists, including myself, that work on that product, and also the chemotherapy order templates, and we have a team of nurses that work on that product. So the compendium is a searchable database designed to support decision-making around the use of drugs and biologics in patients with cancer. And just like the guideline, this will include both on-label recommendations as well as any off-label recommendations that the NCCN panel has recommended. And this product is recognized by insurers as an authoritative reference for oncology coverage policy. So for example, as of 2008, this compendium was recognized by the Centers for Medicare and Medicaid Services, or CMS. And of course, we are also recognized by private insurers for coverage determination. And then we have the chemotherapy order templates. So those are designed to improve the safe use of drugs and biologics in cancer care. And they provide standardized information on dosing and administration schedule, supportive care, monitoring parameters, and safety instructions. The regimens that you'll see in our chemotherapy order templates come from the reference guidelines. So we use the guidelines as a reference. Also, we reference the prescribing information and then any applicable primary literature. And our templates also go through both an internal and an external review process. We have a committee that's made up of nurses, pharmacists, and physicians from our member institutions, and they will review the templates before they are published. And this is the Drugs and Biologics Compendium landing page. So this slide is kind of busy, so I'll kind of walk you through it. If you look at the drop-down menus over here on the left, you can see that you can search by guideline. From there, you can further narrow it down by disease setting within the guideline. You can search by the agent, and that would be the generic names for the drugs or biologics. Search by brand. I will highlight a new feature that we have, which is the ability to search by regimen name, and that's tied into our chemotherapy order templates. And on my next slide, I'll go into a little bit more detail on that. You can search by route of administration, by histology. Going over here to the right, you can see the drop downs for category of evidence, ICD-10, and billing code. And under the drop downs, we have some other links. So we have the no longer recommended uses, and that's a list of archived compendium entries that had previously been recommendations but are no longer active. So those are the recommendations that have been taken out of the guidelines. Under that, we have the transparency process and recommendations. That will be listed by the guideline updates, or list the guideline updates by version and year. And this is where you can see the panel meeting dates. You can see who attended the panel meeting, the evidence reviewed during the meeting, and then the outcomes of the discussion and the voting. And under that is a link to our user guide. And going down here to the bottom row, starting from the left, you can see the downloadable print view. So that's where you can print or make a PDF of your selected entries. We have the NCCN source guideline, and that's where you'll be able to click directly into the guideline to open it. We have the agent, the brand name, and with the brand name, you can actually link, or you can click on that and it will link you directly to the most updated prescribing information from the FDA website. So then we have pharmacologic class, histology, route of administration, ICD-10 codes. The column here for NCCN recommended use is where you're going to see the bulk of the entry. So that will actually summarize the recommendation from the guideline. Next to that is the category of evidence and consensus. Then we have the chemotherapy order template with the regimen name, and that will allow you to link directly to the template if you wanted to pull that up. We have the FDA on-label indication, and that is continuously updated by the pharmacists as the prescribing information changes. And then we have the billing codes, and that's the Healthcare Common Procedure Coding System codes. And this slide further highlights our new feature, which is the ability to search by regimen within the Drugs and Biologics Compendium. So if you look to the left, you can see that you can type in a regimen name. So let's say you wanted to see all the variations of CHOP. If you type that in, you'll see them appear in the dropdown. If you look over here to the right, you can see that you can also search by individual drug name. So for example, if you type in doxorubicin, that will bring up all your CHOP options and of course, any other doxorubicin containing regimen. And this slide shows some examples of the Drugs and Biologics Compendium entries. So this is what it looks like when it's all put together if you were to bring up your entries. So again, going over here to the left, you can see that under the guideline name, you can click on that. It would bring you directly to the guideline. Under the brand, if you were to click on that, that would bring up the most recent prescribing information. Going over here to the middle, like I mentioned, the NCCN recommended use is going to be kind of the bulk of the entry where you can see it all typed out. Under NCCN category, if you were to hover over that, you would see a bubble that comes up that explains what the categories of evidence and consensus mean. You can see the chemotherapy order template with the regimen name underneath. And again, you can click directly on that template name and it would open it up. And then over here, the updated FDA indications and the billing codes all the way to the right. And this slide is an example of one of our chemotherapy order templates. So you can see at the top, we have the disease name and the regimen name. Looking over here to the left, you can see the indication. In the middle, you will always see the reference guideline, and that is a hyperlink you can click to open it up. You will also always see the primary literature. You can also click on that to bring up the literature. Over here, we have the supportive care. So this will provide the emetic risk and febrile neutropenia risk. Under that, we have regimen dosing and schedule. Supportive care, so those will be your interventions to minimize toxicity. Recommended monitoring and hold parameters, and then the safety parameters and special instructions. And with that, I will turn it over to my colleague, Marian.
Good morning. I'd like to take a little time to tell you about our other 3 compendium products, and this includes our products for biomarkers, imaging, and radiation therapy. And like the NCCN Drugs and Biologics Compendium, these are also based directly on the NCCN guideline information. The NCCN Biomarkers Compendium contains greater than 1,400 testing recommendations that are sourced from 68 of the NCCN clinical practice guidelines that contain biomarker testing information. It's a searchable resource for NCCN recommended biomarker testing. And we have also initiated a program earlier this year with a biomarkers resource committee that's going to provide some expertise and recommendations for helping us standardize our biomarker testing recommendation terminology across the Biomarkers Compendium. The next resource we have available is the NCCN Imaging Appropriate Use Criteria, the Imaging AUC, and this contains greater than 1,200 imaging recommendations from the 73 clinical practice guidelines that contain imaging recommendations. In addition, we have an Imaging AUC Resource Committee that contains a lot of radiologic expertise, and their expertise is available to all guideline panels for any queries related to advanced imaging. This is a resource that was designed originally to meet requirements for the CMS Imaging AUC program, which has now been paused. And the Imaging AUC are available at no cost to users on the nccn.org website. The NCCN Radiation Therapy Compendium includes over 1,000 radiation therapy recommendations from the 58 clinical practice guidelines that contain radiation therapy. At this time, 6 companies licensed the NCCN Radiation Therapy Compendium for use as a reference, and we have a new licensee that is looking to incorporate RT Compendium information into their electronic tools. Can we have the next slide? So just to show you what the landing and search page looks like for each of these resources, I'm also going to point out that I've put a contact email at the top there. So if you have any questions about the Biomarkers Compendium, feel free to email. That is actually my email address. So I'd be happy to answer any questions there. Similar to the drugs and biologics, we have a landing page where a user can narrow their search using drop-down menus, searching by guideline, disease, by the Hugo gene symbol or alias, as well as the molecular abnormality in question. In addition, there are other fields that can be displayed optionally that include the specimen type, the methodology used in the testing if it's specified in the guideline, the purpose of testing, and any additional clarifying notes that are part of the guideline. And so at the bottom here, I've included just some brief information from one of the testing recommendations from the uterine cancer guideline for microsatellite instability testing. And you can see that shows what the test detects, changes in short repeated DNA sequencing, the category of evidence, and also the additional information, the NCCN recommendation. So that highlights exactly where in the guideline is the testing recommended and under what circumstances. And we also have a print view of this that a user can either download or print a PDF, and that's shown in the next slide. And this is just a condensed information. Could we have the next slide? Thanks. So this is a print view that's a user can use to download all of the information in a PDF format. And this contains all of the same information shown in the previous slide, just in a expanded format. And imaging landing page is in this next slide. Here I want to also point out that our imaging scientist, Nicole Blankenhorn, we have her email address at the top there in case anyone has any questions they'd like to address directly to her. And we've also set up the search page very similar to the drugs and biologics and biomarkers, where a user of the imaging AUC can search by guideline, by the clinical setting, purpose of the imaging modality, and the ICD-10 code. And we also have some additional fields that a user might wish to display that include the stage, frequency that with which the imaging is recommended, and any additional notes, and the guideline page where the recommendation is found. And we also have a PDF download available for the imaging appropriate use criteria. And this is how this information is grouped on this slide. At the top, we have the disease information, including the guideline, the disease, the clinical setting, other disease-related information, and the exact location within the guideline where the recommendation is found. And then some additional imaging recommendation is found on the lower part of the PDF, including the frequency, the imaging modality, and any additional relevant notes, as well as ICD-10 code. Radiation therapy also has a very similar landing page where a user can search by the guideline, the clinical setting, indication, the purpose of the radiation therapy modality, and the ICD-10 code. We also have some additional display fields that include the category of evidence, the stage, histology, and the guideline page. So before I highlight the new feature here, I just point out that we have an example entry at the bottom of the page from Hodgkin lymphoma. showing the scenario where radiation therapy is recommended, the guideline page where it's located, category of evidence. In the modality, you can see some of the modalities are underscored, and that if the user hovers over those, then that acronym is expanded so that you can see what's actually meant there, as well as other terms within the radiation therapy compendium. If they're underscored, then the hover over feature shows the expanded version of of the abbreviation. And this also includes the dosing regimen and additional NCCN notes in there. The new feature that we have in the radiation therapy compendium is a display feature for the normal tissue dose constraints. And if you see the blue box underneath the display fields, if normal tissue dose constraints for radiation therapy are contained within the clinical practice guideline, then that blue button will appear and the display it will pop up, linking there. It will pop up a new window showing the page within the guideline where the normal tissue dose constraints appear. And that's shown on the next slide. So for Hodgkin lymphoma, if that button is clicked, this page will pop up, giving the user the information from within the guideline on the normal tissue dose constraint recommendations for lymphoma. So that's a new feature, and we're hoping that this is very useful to our radiation therapy users. And in addition, the RT compendium also has the print view that the other compendia entries do, with the disease information highlighted on this slide on the left from Hodgkin lymphoma, and additional radiation therapy information expanded on the right side of the slide. So you can see the rationale for treatment, the dosing, and additional information within the notes field for other additional radiation therapy information. So why use the NCCN Library of Compendia? The most important reason is that these are all searchable databases, and the data contained within them is derived directly from the NCCN clinical practice guidelines. So this means that a user can hone in immediately on their imaging resources, the drugs and biologic that they're interested in, or the biomarker of interest, rather than flipping through the entire guideline. Reports can be customized, and search features based on modality or specific characteristic or disease state can be used to narrow searches down just to bring back the information that the user requires. They distill the guideline recommendation into a digestible information that can be used at point of care, for utilization management, or within electronic health records. And I should also point out that these resources are evergreen and they are continuously updated in real time in concert with the update of the clinical practice guidelines. And where can we find these guidelines? Well, the compendia. 4 of the compendia products are available for subscription at the NCCN store, indicated in the blue box there. And that includes the Drugs and Biologics Compendium, the Chemotherapy Order Templates, Biomarkers Compendium, and Radiation Therapy Compendium. All of these are available as either a single product or combination of products for yearly subscription, and pricing is based on the number of anticipated users. There are also site licensing options for the chemotherapy order templates for integration of that information into electronic health records or other health information technology. And this requires subscription to chemotherapy order templates as well. And the NCCN Imaging AUC do remain free to end users per CMS requirements. All that a user needs to do to access the Imaging AUC is register on the NCCN website. And on the next slide, I'd like to acknowledge the NCCN Compendium and Templates teams that build these resources. The Drugs and Biologics Compendium is built by a team of oncology pharmacists, including Sarah DiVincenzo, Evelyn Handel, Brianna Herron, who you heard from already, Ann Holbrook, Ann Carosis, Daniel Louis, and Sharon Park. The chemotherapy order templates are built by a team of oncology nurses that include Megan Fay, Kyle Herman, Madeline Joyce, Betty Ann Sunderland, Samantha Tambro, and Amanda Visnick. The Biomarkers Compendium is the product that I'm responsible for maintaining, and I do that in collaboration with Erin Hessler, our Compendium specialist. Nicole Blankenhorn is our imaging scientist, and she maintains the imaging appropriate use criteria, along with help from Erin Hessler, our new Compendium specialist. And the Radiation Therapy Compendium is maintained by Donna Powell, again, in collaboration with Erin Hessler. So I'd like to thank you for your attention, and we'd be happy to answer any questions that you might have. Okay, I've got a question that I think this will be for Brianna. Can you search chemotherapy order templates by adjuvant therapy alone?
So if you mean, okay, so if what you mean is, can you go into the chemotherapy order search and put in adjuvant to kind of narrow it down? No, we don't have that capability, unfortunately. Yeah, I mean, it's really just, you would have to either type in the drug name, which brings up all of the associated regimens, or the regimen name, but no, we don't have that functionality at this time. Okay, it looks like we have no further questions at this time. Marian, did you want to wrap it up?
I'd just like to thank everybody for your attention, and I guess we can give you back about 5 minutes.